Complications of sleep apnea. Sleep apnea is a sleep disorder characterized by repeated interruptions in breathing during sleep. Some of the complications associated with sleep apnea include 1. High blood pressure. Sleep apnea can cause high blood pressure or make it worse if it's already present. This is because the repeated pauses in breathing can cause your blood pressure to rise. 2. Heart disease. People with sleep apnea have an increased risk of developing heart disease. This is because the repeated pauses in breathing can cause stress on the heart, leading to an increased risk of heart attack, stroke, and other cardiovascular conditions. 3. Type 2 diabetes. Sleep apnea is associated with an increased risk of developing type 2 diabetes. This may be because sleep apnea can affect the way your body uses insulin, leading to insulin resistance. 4. Daytime fatigue. People with sleep apnea often experience excessive daytime fatigue, which can affect their ability to perform daily tasks and may even lead to accidents. 5. Depression and anxiety. Sleep apnea is also associated with an increased risk of depression and anxiety. This may be because of the disrupted sleep and the effects of sleep deprivation on mood. 6. Memory and concentration problems. Sleep apnea can affect your memory and ability to concentrate, making it harder to perform tasks that require focus. 7. Headaches. People with sleep apnea often experience morning headaches, which may be caused by the interrupted sleep. 8. Sexual dysfunction. Sleep apnea can also cause sexual dysfunction in both men and women, including decreased libido and erectile dysfunction in men. 9. Complications during surgery. People with sleep apnea are at increased risk of complications during surgery due to the effects of anesthesia on their breathing. 10. Liver problems. Sleep apnea is associated with an increased risk of non-alcoholic fatty liver disease. 11. Sleep deprivation. Sleep apnea can cause chronic sleep deprivation, which can lead to a host of other health problems, including obesity, diabetes, and high blood pressure. 12. Untreated sleep apnea can cause devastating problems. HTN, cardiovascular, cerebrovascular stroke, type 2 diabetes, depression, congestive heart failure, mood disorders, stroke, congestive heart failure, heart attack, atrial fibrillation, tachycardia. It's important to treat sleep apnea to reduce the risk of these complications. Treatment options include continuous positive airway pressure (CPAP), oral appliances, and lifestyle changes such as weight loss and avoiding alcohol and sedatives before bed.
Apnea, falling asleep at work, non-restorative sleep, brain fog, memory problem, poor concentration, morning headache, type 2 diabetes, metabolic syndrome, impotency, and cardiovascular problems, including high blood pressure, strokes, heart attack, congestive heart failure, etc. It could be deadly. Pause here and read about these complications.